Okay, welcome everybody to the June 16th Health and Human Services Committee meeting. We have what I'm calling an overstuffed agenda. I don't really like to do this, but today it exists. So we have a lot of things that are going to go on today, and we're going to do our best to get it all in and be thorough, but also to try to keep things moving. And we might do we probably will do some mixing and matching of the agenda items and move them around a little bit on the fly. So I appreciate your accommodating the stuff schedule we have today. And in case I forget, I'm just going to mention this now in case I forget later on, that our next meeting in June, the date has changed due to the Juneteenth holiday. So the next Health and Human Services Committee meeting is on June 15th at 1 o'clock. That's a Wednesday, I believe, right? All right. Okay. So with that, let's just get a few pieces of business out of our way, and then we will get into our first presentation. We have 3 big presentations today. Changes to the agenda. We have one addition, right? We have this memo that's on your desk or it's been emailed to you. It's about approval of selection of Genoa Healthcare LLC for co-located pharmacy services. So is there a resolution with this, or is it just?
There's no need for a resolution. It's just committee approval.
Okay, so we will be voting.
Yes.
Okay. So do I need to vote to get it added to the agenda?
You can.
Will someone move to add this to the agenda, please? Thank you, Veronica. Is there a second? Okay, screen of people up there. Randy, will you second this? We're just adding this to the agenda. Thank you. Thank you. Okay, so any discussion about adding this to the agenda? All in favor? Oh yeah, we need to do a roll call. Thank you. Randy?
Yes.
Veronica?
Yes.
Travis?
Yes.
Mike Sigler? Is he here? Not quite yet. Okay. And I'm a yes. So that's unanimous. Thank you. Okay. Public comment. I don't think there's anyone here. Is there anyone here from the public to speak? No? Okay. I do not have a chair's report, and the county administrator has informed me she does not have a county administrator's report, which brings us right to our first presentation, which is about the sanctioned homeless encampment, City of Ithaca. There's a memo on our desks. There's a memo that was emailed out last week. And I have a number of representatives here. Guys, come on up. Everyone come on up and have a seat at the table anywhere you'd like. Anywhere is good. And
Dan,
yes.
Excuse me, Rich John has his hand up.
Hi, Rich. Sorry. Thank you. Go ahead.
Thanks, Dan. I was hoping to address the committee before you started discussion. I have participated with the group you're about to hear from. I've met with them and offered input on the proposal you're going to hear today. A question was raised whether, because I am a property owner on the West End, do I have a conflict of interest? And should I be participating? And I've thought through this. I do own property on Tabor Street in the city of Ithaca. And in theory, there could be some benefit to me if we did something to address the unsanctioned camping. There certainly is no direct financial benefit, but it could, in some years to come, cause some benefit to the value of the property that I bought a couple of years ago. In the exercise of real caution, I have decided to not participate in discussions or voting on this issue. However, I do live here, like we all do. And I do own property on the West End, and I've been participating because I'm interested as a property owner, but also as a county legislator. And it's very hard to split that, where the lines of interest lie. But I did want to inform the committee that I intended to continue to meet with the group that has been considering this issue in my private capacity, but I would not come back to the board or enter into discussions.
Hey, Rich, thank you for putting that on the record. Appreciate that.
Thanks.
One more thing I wanted to say before we dive in is that, the second presentation today is the Tompkins County Homeless Needs Assessment Report. And maybe in a different world, one would have gone first because it kind of would have set the stage for this second conversation. But for various reasons, scheduling and other, I didn't do that. So I just wanted to say, it's not a comment on the importance of either one or whatever. It was just a scheduling issue. Okay. So we have a group of people here today. You are not the city of Ithaca. You are a private group or a group of concerned citizens. I don't know. You can define it for yourself. Just wanted to make that clear too. And what I'll have you do is just start. And when you speak, just please introduce yourself. Sound good? You're on.
I'll go ahead and begin. My name is Cynthia Brock. I am a representative for the city of Ithaca on West End on Common Council, First Ward, along with George McGonigal. The other members of our team who are here is Carmen Guidi with Second Wind Cottages, Nels Bone with Ithaca Urban Renewal Agency, Michael Carpenter, who is an interested business owner on the West End. We have Chris Teitelbaum, who is here remotely. He is the manager or I think director for St. John Community Center. Jerry Dietz, who's also a West End property owner. We came together in basically in response to a great need that we are seeing evident on the West End, especially in the Nate's Floral Estates Cherry Development District. And in order to give the best presentation, I think we will start at the beginning with Nels Bone, who will give some background as to what our team is responding to.
Yes, the Mayor Myrick in 2021 asked me to help work on an issue he was facing, which was unregulated encampments. So he asked for some policy proposals to think about and bring to the Common Council. That seemed like a pretty straightforward proposal at first. It gets more complicated as you work more on the issue. But the real issue was what was the city's policy and what should it be? And we discovered there really wasn't a clear city policy at all. And that the recommendations coming out of that analysis was that the city should have a formal policy. Exactly what the policy should be is still something that has to be worked out, but that with not having a policy, we were making issues probably worse. And we weren't giving any direction to city staff or anybody else in the community what was the city's position on the issue. Out of the report came a couple of findings. One was what I mentioned, that there should be a policy, an explicit policy of the city, that the city should be ready to enforce and implement. And secondly, that our continuum of care and our options for people who are encamping on city property is very thin and very small and doesn't meet the needs of many of the people. Some people who are encampments don't have the choice of coming into shelters other than during the cold weather policy, such as somebody on a registered sex offender or somebody who's been sanctioned by DSS. Others have mental health issues and substance use disorders that make it very difficult for them to work through those systems. So that's the reason why we see a lot of people who are in encampments. It's also why we see kind of a seasonality to it as well. I think we can say safely this year that there's been a pretty large increase and also geographic dispersion of the encampments. Those encampments have been a challenge for the city for many years, but they've basically been limited to one area of the city behind Walmart and Lowe's, but in the last couple of years, they have spread. With them come fires, hygiene issues, and a number of other, issues for the neighborhood surrounding them. It also turns out that it's very difficult for service providers to get to people when they're dispersed. So we looked at four major approaches that communities take to encampments. One was clearance with no support, which is essentially a no tolerance approach that some communities take towards encampments. It's illegal. It kind of criminalizes homelessness in many cases. Secondly, was kind of a clearance with some supports to help the people who are camping find other options. Third is a tacit acceptance without any explicit policy decision, which I think you've already learned that that's the city's approach so far. And finally, it was a formal sanctioned encampment with supports for the occupants, which is what a lot of West Coast communities are doing now. Of these four options, there's pros and cons to each of them. But the city is at a tacit acceptance phase right now. It would like to move away to something that leads to some better outcomes. And to accomplish that goal needs to be more options available for people who are in the encampments. So that's really the main focus is city should have a policy, and it should be focused on trying to expand the options for people options to encampments, ones that will be acceptable to the people who are living in those encampments. And I think we were going to lead to Chris then in the next phase of this.
Hey, thanks, Nels. Can everyone hear me?
Yes.
Excellent. Thank you. And County Legislature, thank you for having us. I'm Chris Heidebaum. I'm the Regional Director for St. John's. We operate the homeless shelter, essentially at behest of the county. you pay our bills. One of the things I want to get into before I actually talk about the actual concept that we're going to propose here is that while the city does not have a set policy, the county also does not have a set policy, and the county is actually providing a lot of services to individuals who are inhabiting the encampment. You're responsible, as you know, for a lot of the mental health, law enforcement, social services, this entire fabric of services which surrounds folks is under your purview. But it's all kind of like here and there, right? All sort of around. So one of the things we'd like to move toward is the county having a straightforward policy about encampments that coexist with a city policy. And we think that this proposal is a nice way to accomplish both of those things. The Tides encampment would be a sanctioned encampment whose function would be to provide safe, healthy, staffed, and secured space for up to 50 individuals, formed primarily of 25 cottages, for lack of a better term, that two people could occupy at a time. It would meet New York State Department of Health requirements for campsites. Would have 24-hour, 7-day-a-week on-site management, central facilities, sort of quasi-permanent central facilities, where people could utilize for showering, hygiene, cooking, and I think really importantly, as I'll get to in a second, gathering and community. One of the things, the issues right now with the encampments is in many ways we have a community which is existing on the fringes of our society, and we'd really like to provide a space where these folks can really practice community with the full-fledged support of the county and the city, right? As they then move, hopefully, into the main economy and community, right? Either via private market apartments, supportive living, or other sort of things. And where they're safe to do that, to practice those skill sets. We would provide trash removal, and maybe most importantly, what this would provide is a safe space for all the services which you are currently providing and paying for to exist in one centralized location. I like to describe it as the encampment is really sort of the bread, and all these services are the meat, right? So all your outreach workers, your private NGOs like Reach and so on, parole, etc., could have one central location where they could go meet with people on a daily basis, and help them with the things that are really sort of gaining their way for coming back into sort of Ithaca as a larger population and economy. And as it was already mentioned, it would provide very easy and safe access to our EMS and other emergency service providers, right, to sort of get in and help out people. And one thing I want to add that I think is really important is that right now in the encampments, we have a population, because the kind of operates under the law of the West, that ends up getting victimized. We deal a lot at the shelter with individuals who are fleeing the encampment because there's been some dispute. It's very easy in the encampment for one person to sort of have undue power, right? Really through extortion or threats of violence. IPD deals with this a lot. And so we really think there's some benefit to having a space where everyone can be, and there's some central kind of rules, right? And I think those rules get decided upon in conjunction with the participants, but where people can be safe, right? And they can look to us as their county, city, and service providers to provide them with a degree of safety while they are trying to get back into the normal economy. Thank you. I think we'll jump to Jerry next. Jerry, yep.
I don't see Jerry. Is he gone? Is he not
gone.
any longer? So I'm gonna step in. I'm Carmen Guidi, founder and acting director of Second Wind Cottages. This situation goes way back for me. Just to give you a real quick background, I probably 12 or 13 years of spending time in the jungle with folks. And so our goal is for tides to minimally impact surrounding property owners. And the formation of tides would allow the city to develop a policy to prohibit camping on city land and other property without the permission of the landowner. You know, as we're going through this process, we're hearing the word camping a lot. And I've talked to the group offline on this, but when we hear camping, we think, oh, let's go camping, right? I mean, that's what I think, right? Let's go camping. Let's take the family camping. This is not that kind of camping. Okay, folks, just so when because words are important, you know, when you hear a word or see a word and you see camping, I automatically think of a jolly time with my family, right? S'mores and the campfire, and that is not what we're talking about. We're talking about people that are in destitute situations. We're talking about people that are living worse than some of our animals live. Okay, it's not a pleasure thing. And people have the opinion that, well, some of those people want to be there. That can be a plausible argument, but most people don't want to be in that situation. Most people have been there so long that they're stuck in that situation and they've lost all hope of getting out of that situation. And I'm really going off the script here. So the preliminary cost estimates for construction of tides are within a range between, I don't know if you have this paper in front of you. I'm just reading off of it right now. 1,250,000 and 1,750,000. So there's a range there for the initial cost to build the structures, the infrastructure, the central building. Now to me that's a big number. Okay, I started Second Wind Cottages. Big number scared me, so I'm a conservative person at heart. We believe that this number can be much, much smaller with volunteer help. And I want to stress how important that I found out that was when I started Second Wind. Again, conservative mindset, not a lot of money. I didn't want, and I would say the same thing here. Whether it's the city's money, the county's money, listen, we're all in this together, right? Wherever it comes from, it's money, and we all should do the best we can with it. That's how I feel about it anyways. You know, let's not just throw out billions of dollars just because, oh, someone will pay for it. Eventually, we all pay for it. So I'm going to come at it from a conservative standpoint. So that's why we elected to have volunteers build Second Wind Cottages, and they did. The first day we started to build, we had 125 people from the community show up to build these cottages. I mean, it is something that people want to do. They want to get involved. They want to have some sweat equity in these things. And plus it's a plus because we don't have to pay for labor. So this number, I think, can be diminished quite a bit. We get donations from business owners, things like that. So that's the actual building. And then it is currently anticipated that city land would be made available for this purpose. My argument has always been, why not do something right there? The people are already there, right? They're already there, and they haven't elected to move them off of there. So, anyways, and it's a good location for proximity to services and so forth. So the land acquisition costs are not included. An estimate of operating costs is between 800,000 and $1 million per year. Yeah, another quite some numbers, right? Big numbers. But I don't know if any of you have been in the place called the Jungle. I don't know if any of you have walked through there and actually seen what it is, how people live. That number, if you did, I don't think that number would mean much to you, to be honest with you. When you see a woman, a young lady that's, 8 months pregnant, living on the ground, I don't think that number will shock you. I think that it's important to know what the situation really is, because numbers on a paper say, "Oh, that seems like a lot of money." It is, but when you put it into perspective, it really isn't. The wide range of construction operating estimates reflects variables in any final proposal, as well as in the value of in-kind contributions. We're hoping that the city will. In-kind contributions, like we're hoping the city would put the water in, the sewer in, the electric in, things like that. Constructions of the campgrounds anticipates the application for and use of grant funding. Operating cost estimates are informed by the current operation of St. John's Community Service and Second Wind Cottages. So words on a page, guys, really, you could have read this. You probably got it in front of you, right? I didn't even read it, did I? Words on a page, real people's lives. And I don't know how much time you give me, but this is a passion. This has been a passion of mine for 13, 14 years. I believe every human being should live with a sense of dignity. When you visit the Jungle, there's no dignity at all there. And it's right. It's among us. We have some, you think about you may be thinking about, well, this guy's a business owner. He's just here because he doesn't want this to, you know what? I've spent a lot of time with this group. This group is the real thing. This small group that Cynthia and George really put together. And by the way, let me tell you how this happened. Cynthia and George asked me if we could take a tour in the Jungle one day. February, was it? February. We walked around. It was going to be 20 below zero that night. We met some people. Before Cynthia got in her car, she said, "Would you be willing to have a conversation to see what we can do?" And I said, "Hey, you know what? I've been asked to be on a lot of these committees, a lot of these task force, and they've dead ended. We haven't really come up with anything." I said, "Yeah, sure, I'll do it." You know why that happened? Because they walked around and they saw the situation and they met people and they were real people. And they said, I don't think they slept well that night. I really don't.
Excuse me. We're gonna have to move on.
Yep, that's fine. So that's all. I read my part and I said my piece, I guess. Thank you.
Appreciate it. I'm just going to throw in, it's an honor to meet you. I've read about you for years and I don't think we've ever met in person.
Oh, well, the honor is mine.
Thank you.
Thank you.
So I will be the last speaker and I'll wrap us up. But as you can tell from all of us, we are a passionate group made up of service professionals. Chris and Carmen have been doing this for many, many years. We have elected officials, we have business owners, we have property owners, we have neighbors. We're all here trying to come up with a solution to support our community. We came and made a presentation on April 20th to the City Planning and Economic Development Committee. They were the first presentation that we made, and we did receive very strong unanimous support of the committee in anticipation with the clear direction that we come to the county and ask for county support, because we recognize this is a partnership. The city can provide the land and the infrastructure, but it will only work with county services and support. The county's role would be to partner with the city as well as the non-for-profit organizations and provide support for both developing and operating ties, as well as the necessary wraparound services that the participants would need. It would also require an ongoing component of TIE's success would be the county's expansion of permanent and programmatic supportive housing opportunities for those who are facing addiction and mental health challenges, as well as the structural barriers that Chris mentioned earlier. The city could work with the county to earmark our home ARP funding to support a housing project that addresses the needs of unsheltered homeless individuals. It is important to know that our proposal is not a housing solution. It is not a long-term housing solution. It is instead a program to meet people where they are, to stabilize them, support them, get them ready to get into permanent and or supportive housing. What we are here today is to get a general indication if there is a desire to explore this further, to allow us as a team to carry this forward and actually start to bring partners together, actually start to meet with engineers, look at the site plan, really get a commitment to how this would look like, how we would structure it. We would be able to identify and put together a third-party team that would manage the site. We would, again, we would work on site development, designs for camping cabins, community structures, infrastructure, emergency access, work on developing a more, our funding options together, what we could do, develop our budgets in a more solid way. And if we have your general go-ahead today, we would do this and then come back to both the city and the county for final approval. The bottom line is, as I said, this is not a solution. We think of this as sort of a MASH team that's coming in, assisting people, stabilizing them, getting them ready so that they can move on to permanent housing. In the meantime, allowing the city to establish and enforce a policy for with regards to unsanctioned camping on city property and create this site would provide safety, security, and also stability for the surrounding neighborhood.
Thank you. Okay, I think there are a lot of questions, and just to make it easier for myself, I'm going to start with questions that are from people that are in the room, and then I'll go to the screen so I don't have to keep looking back and forth. And this is questions from anybody, legislators, staff, anybody else that's around. And Veronica, you are starting us off.
Thank you. First, thanks, Cynthia, Nels, Carmen, Chris, everyone for bringing this. I'm excited about the work you put into it and glad people are focusing on it. Also, side note, Carmen, for what it's worth, not everyone watching this meeting has the words in front of them, so I appreciate you sharing it all out. I have 3 questions. I'll try to go one at a time. First, when you say that you'll work to prepare and present a full proposal, is that like the same folks that have been working on it so far will work on it? And to what extent are or could be folks currently living in the jungle involved in the planning process? Because at the end of the day, I think they're going to be the most affected ones and the like core stakeholders of this project.
It would be fundamentally our team that would be bringing together the final proposal. We have met with outreach workers. We have met with neighboring business owners, and we do intend to incorporate the voices of those individuals who are living there now. Many of us have been reaching out to them one-on-one, but having a more coordinated opportunity to interact with them and receive their feedback and work with them to develop this more final proposal would be essential in us bringing this forward.
Good, thank you. I would definitely feel a lot more enthusiastic about a final proposal that came with like enthusiasm from the folks who might end up temporarily living there. Second, you mentioned, as it says here, a necessary component of success is the county's expansion of permanent supportive housing opportunities. And I think we're probably talking about this in the next presentation. But do you think that that should be formally tied into a timeline for this proposal? Maybe this is not a question, just a thought to think of. Like, it would kind of be sad if we had like a great tides proposal that went forward and was built and then was in some sense considered a failure if it didn't get people out of the encampments permanently, just because there was still nowhere permanent for them to go.
See, Carmen.
Yeah,
and also I do want to remind people that George is on our team too, and he's here if he has any comments.
Yeah, if you don't mind, I'll address that. So I understand exactly what you're saying, and with my experience, and I think Chris can, if Chris is still, yeah, Chris is still there, back this up too, is that if if a person is moved into a permanent housing situation and they're not ready for it, it just, you probably know, it's not good. It's not good for anyone. It's not good for the person living there. It's not good for the landlord. It's not good for, so I think Tides would offer that time, right? That time that person would need to, especially being caseworkers working with them and peer specialists working with them, offer them the time that they would need to get to the point where they could enter into permanent housing and it would stick. It's even happened with us at Second Wind. Even before there was Second Wind, I would get people housed and then they'd be back homeless because they just weren't ready. One thing that we really aspire to at Second Wind is relationships. People need that connection. So I don't know if that answers the question, but we definitely, the need for more permanent housing, permanent supportive housing is absolutely there. Even when people are ready to move out of Tides, I think a supportive permanent or permanent supportive housing is very, very important. And you're right. We're in a catch-22, right? They need to get out of here, but where do they go, right? If they're camping off of, even if it happens, if they camp off of Tides and they're asked to move, where do they go? At least it will have a place where they can go, and they can't say, well, we don't have any place else to go. So.
Yeah, thank you. That kind of answered the question. I guess I was mostly asking about the like, let's say you do get someone ready for permanent housing, that's only helpful if there exists the physical house.
We do have 40 units coming on as part of the Green Street Garage redevelopment project, which is targeted for chronically homeless persons. So that would be one project coming online in 2023, which some people may be ready for.
Okay, cool.
Can I add something to, I'm sorry, to what Carmina said? I think one thing that's really important to keep in mind, right, is that we have a population that has in many ways kind of gone and formed their own sort of social construct, as humans are apt to do, right? And so one of the cool things about Tides is that allows people a space to get sort of acclimated to Ithaca, to society. We have many people, we have a success story right now in the jungle. I'm hoping, fingers crossed, success story, a young woman who has been through again and again and again and again, has gotten caught in that cycle of camping, coming in during cold weather, and we have her back into camping and so on. And now she's at the place where enough trust has been built. She's gotten used enough to to be honest, I think a hot running shower whenever she wants it, that she's like, wait a second, I'm ready now with the supports, the wraparound services to go into this next thing. So I just want to make sure that we're not going to fool ourselves into thinking that people will not go to Tides, leave Tides. They maybe need to come back to Tides as they cycle on their own natural life progression. Some people, they get into housing and they're just not ready for it. And they end up getting evicted or other things. And we don't want those folks having to go back to a lawless environment if that unfortunately happens. We want them going back to someplace where they are safe and the community at large is safe and is fairly organized. And the workers that the county really is responsible for have access to them. And they have access to those workers in a safe environment. I think it's just really important to stress that point.
Okay, thanks. I know we have a lot more questions, so I'm going to ask, I think we're going to get to the point very soon where we need information about what it's going to take for the county to, sign on in whatever form we do. So I'm going to ask people to really try to focus on that as they can. Veronica, did you have a third question? Did you get to it yet?
I didn't. Thanks. Sorry, I'll try to be quick.
No
The bit where you're saying this would allow the city to develop a policy to prohibit camping on city land is really my one concern with this. I don't look at the end of the day, any space with any barriers at all, this has at minimum a population cap, right? There can be people who aren't going to fit in it for whatever reason. And so where are they going to live? I'm very opposed to essentially criminalizing existing in the city. I guess that's not a question. That's just something I want to say. I don't like this, and I'm curious this idea, and I'm curious what you're thinking.
I could quickly respond to that because the proposed policy piece that's going to be presented at the city's Planning and Economic Development Committee meeting on Wednesday proposes that the city policy should take into account that there aren't enough locations for people to go and use kind of a priority enforcement approach, not authorize encampments, but set a priority on where the city is going to use its resources to move people away from. So it would say, well, if there's a sensitive area right near a neighborhood, near a natural resource, for example, those areas should not be located for places for encampments, but there would be a low priority enforcement focus on areas that have less sensitivity, better access for services, such as behind Walmart and Lowe's. So that would be the practical approach. Would be there would be tolerance of encampments, but there would be an effort to kind of cluster them and stop the dispersion throughout the city.
And if I may, we did start with a number of 25 cottages that could hold 2 people who are already sort of a domestic family. I think this is going to be flexible. We're here to try to serve all the individuals as we can and hopefully accommodate those who are willing and interested to participate.
Randy, Shauna, okay.
Your committee member?
Doesn't matter to me.
Oh, sure. Okay. I just wanted to say thank you, Carmen. Thank you, Chris. You guys are the ones that are in the trenches and have been there for years and years and years. And so I just want to thank you from the bottom of my heart. You do really sometimes thankless work, and we appreciate you. Secondly, I want to support this. And I've gone to the jungle a few times and I've seen the poverty. I've seen what's happening in the jungle. And certainly the times that Tammy's taken me out, I have struggled after leaving. But I do have some concerns. With that said, in order to have a collaboration, we have to make sure to include the right people in the room. And I'm not sure that that's happened. DSS is going to be crucial for this to work. And I don't think DSS has actually been part of the conversation. Whenever we talk about services, whenever we talk about benefits, entitlements that many people can receive in our county, what we need to talk about as well is the many people that are living in the jungle are what they call sanctioned. And I think Kit Kephart is on the call here, but she could explain it probably better than myself, in that they're not following or doing the things that they need to do in order to receive these benefits. I guess my concern lies in if the county were to step in and provide those benefits, would they ever really get out of this quote unquote temporary housing? And I understand harm reduction, and that's what we're trying to do here. But I think there has to be a compromise and a goal to move people on so that we don't have, essentially permanent housing with the idea that it might have been temporary. And I'll just add 2 more things. For one, I want to make sure that we're very clear and that the HHS committee cannot make the decision alone for this project to move forward. It would have to go to the full legislature. It's not just up to 5 people for this really big decision. And then my next point is on the collaboration. The county has collaborated with the city for the Reimagined Public Safety. And that has at times, I know I've spoken with both George and Cynthia, has been really a struggle. And the communication has been lacking with leadership. It's just been a really difficult process. And in order for me to feel good about this, I think we would have to be able to trust each other. And I'm afraid that's not there right now. So I want to make that very clear that the relationship between the city and the county has to get better.
George, did you want to address that?
Thanks, Shauna. I trust you.
I trust you too, George.
And I don't know if a lot of people know how serious this problem is. People are dying in the jungle. People at Nate's Floral Estates are having their property stolen. They're being intimidated. They're afraid to go out at night. People who shop at Wegmans, other stores on the West End, at night can be accosted, which is not to say everybody in the jungle are doing these things. But the fact that the jungle is so spread out and the encampments are so spread out, it makes it easy for bad guys to hide in the jungle, even if they don't live there. So what we have now is a serious, serious problem. And the county, I know this might ruffle feathers, but social services, mental health, health department, these are all county responsibilities. And the city is responsible for public safety. And we want to work together to make this better. It's not going to solve everything, as Cynthia mentioned, but what we're doing now is getting worse for a lot of people. So even if we don't have everything lined up on the other side, I really feel very strongly that we need to get started. And this is one thing we can do. And we're having trouble convincing our colleagues that that we can give up city land to do this. Well, we're working hard to do that. So please, we want to work together on this.
Randy.
Yes, thank you, Dan. Yeah, thank you for bringing this forward. It's an important issue and making it very visible, not only visually, but also as far as the information. The homelessness study that we're going to be presented later on today was very enlightening. I think well done, and it does coincide with this. So, but I have a few questions. One, Carmen, I know you built those cottages on your property. Do you get revenue from anybody to help you with those people?
Yeah, I'll answer that one.
Does anybody?
So it's yeah. So Randy, I turned that property over to the nonprofit that I started when we started. So it's not my property.
Not you, right. Does the organization get?
The organization, yes, the organization. Yep, we built those, and we're kind of a hybrid model, to be honest with you. So we do take DSS housing money. We take Section 8. So we work with people where they're at. Some people pay nothing when people come off the street or out of the jungle into a home.
Similar situation exist in this project, where some people may get some type of Section 8 or assistance or not.
I don't know if I want to speak too much into the details of that, but I know from experience and from so many others that have been doing this kind of thing, executive directors of a lot of nonprofits, their advice to me when I began this was to stay as fluid as you can. And what I mean by that is, you can understand, right? Yet be able to do all the, if someone can get DSS services or Section 8 services or whatever, be able to meet people where they're at. Some people, nothing. They may not. They may right. So I don't know if that answers the question.
I understand. I mean, social services actually providing a lot of services to some of these people.
Yes.
Obviously not all. In a complexity of that, and people staying in hotels is quite expensive. I'm not quite sure who's paying for all of that. But I think all that has to be considered when you start looking at this whole system. And the last part of my question is, I think I like what you're presenting and the idea of it. But I think it's going to be complex, no matter how you look at it. There's government involved, meaning us, and that could take a while, right? I mean, it's going to take a little while to figure this out. So this is a good first step. Are there things that you're planning right now to help these people? Is there anything that can be done now? I know there's, they put our houses out and people are bringing in food and those kinds of things, but we may not make it through the winter before all this is done. So I'm just.
In the spirit of time, I'm going to ask that we not answer that question right now. We're at 3:45, and I know there's a lot more questions coming up. So forgive me, Randy, for It's a very good question.
Answer
but-
that for you. Okay.
Anybody else in the room? Questions? Okay, let's go to the big screen. Henry Granison.
Yes, thank you for the presentation. I'd like to follow up with Shauna's question of, you talk about this being temporary. What time frame do you engender, or do you consider to be temporary? And also I want to talk about safety. Chris, when you said that this would be safe, would it be safe by the people you hire, the third parties, or would you involve the police departments?
Yeah, thank you, Mr. Grandison. Let me get the second question first, because it's much more complex, and we're actually consulting with other municipalities that have successfully done these encampments, especially one in Missoula. So we are looking at a model where we have a security team on site, and that's part of that cost that you heard about in the first presentation. One of the issues there is that, as I believe Veronica was really pushing at, you have to have a security team that can create a sense of community, that can communicate with the people there, and can really meet them beforehand and engender the trust that will make the residents, I put that in air quotes, the campers there, be willing to share information. I think like all of us, if things escalate, then obviously you're talking about IPD intervention. But the idea for this is that you have some type of very community-oriented security team that is moving around the community, interacting with people, part of that problem-solving process, and really so that the people there are really policing themselves with help. The first question, which I think was about the time there.
Right.
I'll answer in kind of a sideways way. You've had a jungle encampment issue for the past 50 years, in different areas. So I would imagine that you're going to have this problem as long as Ithaca keeps maintaining rents that are closer or akin to New York City, or higher, and it has a really inadequate number of either zero income, some we don't talk enough about, or very low income housing. Until you have a very effective housing first model, you're really looking at this as kind of a Band-Aid that's really needed. But I think it'd be inappropriate to say how long people will be there. I think you provide the resources that people need to be safe, and have every chance, like we see people go through cycles, have every chance to have that cycle where they land and can get on their feet and move forward.
Thanks.
And champion.
Hello. Thank you for the presentation and for, so much work on this. And I definitely agree. This is very needed. Just a couple random thoughts. I do think it sounds like a great idea, but I would just echo a little bit of what Shauna said. I would not, and I think a lot about process, and I think that the legislature, to be able to back something like this, is going to need more time. I don't think that you'll be able to walk away from this meeting and have, the go ahead to start, understanding that you're going to have the legislature's support. And I would hate for you to go on and do a lot more work and then come back to the legislature and have the legislature say, no, we're not going to support this. So I think it's going to take a lot more discussion. And part of that for me, my district is the town of Ithaca on the west side. And I have constituents who've contacted me before because some of their property borders on some of these areas and is across the river or the inlet, whatever it's called. So I don't know if various neighborhoods have been contacted, if constituents have been contacted. And I personally would want to contact my constituents and ask them what they think. So that would be an important part of it for me. So anyway, those are my thoughts. I do really appreciate all the thought and the time that's gone into this.
Jerry, I see your hand up. Did you want to respond to something that Amanda said?
I did. Thank you very much. Actually, what Amanda just said, I apologize. I had to step out before. I was dealing with a family problem, and I'm sorry I missed my part of the presentation. But one point I want to make here that I think bears repeating and repeating and repeating. First of all, no one on this group, on our entire group, says this is a silver bullet, that this is going to take care of all the problems. I can tell you with certainty from talking to people that live down on the west side of town, people that do business down in that side of town, that they feel victimized, that they feel that no one is listening to them, that these problems are continuing with impunity. No one wants to take care of this problem. We're not here today with a solution that is going to take care of all of this. We are presenting an idea that will be the beginnings of taking care of some of it. We are trying to minimize the impact of the encampments on our community. We're not asking, I understand that the entire legislature has to vote on this. This is not what we're asking for today. We are just sort of looking for an indication of, do you think this is a good idea? Is this a humane way to treat the people that live in these encampments? Is it better than what exists now? That's, I think, what we're asking everyone on this group to consider. Not to give us, we understand we're not walking away with a vote. We haven't given you probably, or the city, enough information to make a fully informed decision, but we want to continue to do the work to get us there. Thank you.
Thank you. Travis Brooks.
So, Chris, you were wrong. The encampments have been around for over 100 years. You can find articles that talk about the jungle going way, way back.
Yep.
So it's been a problem for over a century.
Yep.
At the end of the day, Jerry and others have said that this isn't the silver bullet, that this doesn't fix it for everybody. But winter's going to be here before we know it, right? We just got out of winter, and before we know it, it's going to be here again. And the number of folks that don't have a place to go to, we've talked about all of that. So I'll skip all of that. The program that I do called LEAD, the number one issue for most of the folks that we want to provide service to is housing. There's nowhere to send folks. We are bleeding money out, putting people at hotels, right? Because they don't have anywhere to go. So if this solves an issue for 60%, 70%, 50% of the folks that are houseless, then we're on our way to doing something good for people, right? But decisions have to be made soon. We have to kind of wrap our minds around the idea that this has been here for 100 years. And until we do something different, it's not going anywhere. If Carmen has an example out there at Second Wind that works, why not replicate more of the same? I do have concerns about who may not be at the table. And I know it's not too late to bring people to the table. So I'm wondering why Reach isn't at the table. They work with a large group of folks in the encampments. I'm wondering if we talk to folks in the encampments, like a good number of folks, to see what it is that they need. I'm concerned that many folks are already sanctioned through DSS and won't be able to get services, and what needs to be done during this time to get the state, because it's a state issue, to move on how they deal with sanctions. So there's a lot of things that have to happen at the same time in order to get us to a place where we can start building. We have to understand that there's not a lot of developers coming into town saying, let me figure out how to do low-income housing, no-income housing, right? And then we have to understand that until we can transition people, just talk to folks at the Art House. We put folks in there that weren't ready and didn't give them the services that they needed. So transitional housing is huge. It's incredibly important to get people ready for the next step. So we have to move on this quickly. We have to wrap our minds around, we have to look at how we do mental health services. And are we going to provide mental health services where these folks are at? There's a lot of questions that have to be answered, but there's really not a lot of time to sit back and look at everything and think about this and think about that. We have to speed up our process as decision makers, and we definitely have to develop a relationship with Common Council to move this happen. It would be great if by wintertime we were looking at some real solutions, and at this time next year we had some ready to roll out for folks, because this is a massive problem and it's only getting worse.
Can I respond really quickly? Chair, I forgot the chair's name.
Yes, sure, go ahead.
Travis, thank you. And you're right, brother, 100 years. I didn't want to scare people though. I just wanted to, about process really quickly. So we did present to some of the larger sort of shareholders in this process. We had one meeting with lead staff. and sort of listened to kind of their feedback and concerns. We have spoken to a few people who actually have lived experience in the encampment. Really, for the process of getting an idea, and you're all old hands at this. At sort of, if you have too many people in the room at the beginning, the idea is really like, let's get an idea, right? And it's always been our idea that we get this idea, we get a framework, and then we start talking to the people that have to make it happen. This will not work if the people with lived experience, lead, staff, everyone else who's actually doing the work on the ground, family and children's, are now at the table. And we think that a lot of the management process of this, like the nuts and bolts, is that they get to decide a lot of that, right? But we haven't built the house yet, so we have not spent a lot of time talking about the wiring. But that's very much on our mind, and we recognize it's very important. In fact, this cannot move forward. This goes to Veronica's point. This cannot move forward until those people have been brought in and have expressed their concerns and their ideas about how it's actually managed. So I just want to make sure that everyone's clear that we've not forgotten that. That's simply farther down the road.
Thank you. Cynthia, did you want to say something about this too?
Yes. It is important to remember that the group of us, we weren't appointed by the mayor. We weren't appointed by the legislature. We came together because we saw a gap that needed to be addressed. The city's policy is a do-nothing policy. Frankly, the county's policy is a do-nothing policy. And so I appreciate, Randy, your question. What happens this winter? And I guess I asked you, what happens this winter? We are just a group of people that came to do this. The reason that we are coming to you without having a fully fleshed proposal is we recognize we have no authority at all. So even before we start bringing in all of these people, unless we have the support of the city and county, that discussion is not going to go anywhere. So in order for us to actually have a real conversation with real partners who have skin in the game, we need to have your authority to do so. And that's what we're asking for. But we're at this point that we can't go any farther without you. And we also are encouraging the city and the county to move off of a do-nothing approach and try to come up with this solution and another solution, because you're right, this solution is going to take time. So then I look to the county, what are you going to do for this coming winter? Because winter's coming.
Okay, I had a couple of questions. So we're talking about partnering with the county. What is expected of the county in terms of delivering services? Because we are providing these services. This proposal puts people in a different kind of housing and a little more structured. But what would be expected in terms of DSS or anybody else, public health department, anybody else that we've already provided services? What difference do you see in how we, the county, would approach?
I'm looking to Nels. One of the concepts that we had entertained is looking at this as an extension of the St. John Community Center, an extension of our homeless shelter services, maybe a second branch of it that would work with Carmen, and because it is a little bit more dynamic, have a different feel to it. But that is right now the umbrella that we're looking at. And I look at.
Yeah, I think it's another kind of approach that the community outreach team uses, is going to the people who have the greatest needs. They had a lot of trouble making appointments, coming to appointments on time. This would be an opportunity where there'd be a community building where there would be an opportunity for service staff to meet with them at a place where you can find them. Usually. And the idea was to have a community center where there would be an opportunity for private offices, for service providers to meet with the participants.
I just want to be clear. We, the county do outreach already, but you're saying this would make it a little easier, a little more structured. You're not asking us to set up a field office, for instance.
No.
Okay. No. Just being clear. Thank you. Shauna?
Yeah. Thanks, Dan, for mentioning we do have DSS caseworkers that are going out. We have Natalia that goes out as well from Family and Children's. And then we also did Fund Reach this year. And they provided services out there. I guess I question the format and the conversation that's been had, because if we're going to move forward, typically for services like this, we would actually do an RFP. And whenever partners are involved, it gets a little sticky because you're creating the framework, yet you're applying for what could be a possible RFP. So I just want you guys to be very careful of that. I know that we have St. John's and then Second Wind that are involved in this process, but I also want to make sure that you guys kind of exit at some point and allow the group to take over so that you can apply if you would be interested. So
for sure. Yeah. Thank you.
Okay. George?
Thanks, Dan. One thing to keep in mind, I've spoken to a number of the people who actually provide the services. Tammy Baker, I've spoken to probably more than anybody. And they all say that it would be much easier and effective to provide services to people if they were in a more centralized location. They didn't have to go to 4 or 5 different encampments to do the same thing. Another thing to keep in mind with this proposal is we have a significant amount of informal commitment by area businesses to provide some financial support for this. So there's private interest in helping to pay for this. And that may not be here in 3 or 4 years. So I like what Travis said. This is a serious problem now. And I know there are complications, but we need to move forward.
Okay, I had one last question, and then we'll see if we can wrap it up soon. When it comes to housing, Randy, you asked a question earlier about paying for the housing, and if I think you were implying like could the state through DSS or whatever pay for this housing? And it's my understanding that this would have to get certified by the OTDA, Office of Temporary and Disability Assistance. Has to be defined as a shelter. They have pretty specific guidelines. Hang on one second. So you're going to tell me that, I want to hear your answer. And also, is it the intention of Tides or the city at some point to try to get that certification? Go.
I don't know if I should talk on this one or not. You guys interrupt me if I go off, but I don't think so. I don't think that's our intention. If you, as I was addressing, I think Randy earlier about being fluid. So there's these, we talk about people being sanctioned from DSS, right? Where do they go? Does that mean they don't come to Tides? No, we can't have, it needs to be extremely low barrier because that's where the people are at, that's where they're at right now. And we move them towards, okay, as we build those relationships with the people and they begin to trust us, right? Why are you sanctioned from DSS? What can we do to walk you through those steps to get you off sanction from DSS so you can start receiving benefits again, those kinds of things. So I don't know if I'm wrong, maybe I shouldn't say, but I don't think we're going that route because that would kind of tie our hands too much and not be able to offer the housing to the people that need it. That's who need it the most. Those are the most vulnerable people. They're the ones that need it the most. I'm sorry.
Actually, as far as I know through conversations with, and we have briefed Kit and Dina somewhat about this, DSS has no framework to govern the Tides project. DSS operates with people coming through DSS, getting an intake done, right? Getting essentially on their roles. And then those people are sort of governed by state guidelines, which DSS is tasked with enforcing. DSS and also I think OTDA also would have no framework from my conversations with them of governing an encampment, which is why the original idea was that this would essentially fall under whatever rules are applied to a campsite, like say, I don't know, what's a campsite near here? Teganic or something. Yeah, thank you, Buttermilk, right? Something like that. Right now, there's no legal framework, and someone can correct me, but if I believe I'm correct, there's no legal framework for DSS or OTDA to govern a site like this. It just doesn't work inside their mechanism.
I guess I wasn't asking about governing. I was asking about if you're expecting DSS payments.
DSS can't pay for a site like this because there's no framework.
No, we're not.
Yeah.
Thank you. Thanks for clearing that up.
In fact, I don't believe there's an expectation for any payment. The idea about this is that folks who are currently not paying for the land they're camping on would have a better site to camp and a centralized place for all the services which the county is paying for to meet them there. And one thing, I'm sorry, and I know you want me to be quiet, but I really want to stress also, which I'm not hearing a lot here, is the safety of the people there. One of the main things I hear from people coming into the shelter is their stuff is stolen, they're abused, women are abused, both sexually and physically. right? There is traffic at a very low level. There's a lot of stuff which happens to this population, which is incredibly vulnerable. And that's another reason for this, is not only to protect the environment and the businesses from predation, but this population from predation of just a couple individuals, 3 or 4 individuals who get to prey upon an entire village, as it were. Thank you.
Travis Brooks.
You know, to be clear, I was suggesting that DSS does, not DSS, but Summit County Services does go to the encampment, whether it's or to ties with, whether it's 2 days a week, 3 days, whatever it is, that some of our services go to where the people are at, instead of expecting folks in those situations, folks with mental health issues that most of you all cannot imagine, make appointments and go to those places. People need to go to where they are at. That's where success is made. That's where connections are made. That's where things change. We cannot, whether it's mental health, DSS, you cannot keep addressing these issues the same way we've had for the last 50 years. It hasn't worked and it will not work. It's not going to just change because we blinked our eyes and thought it was. It's going to change when we do something different, and it has to be done different.
Okay, is there anybody else that hasn't spoken that would like to ask a question? Remember, we're focused on, does the county want to sign on to this in some way or another? Okay, so you started out by asking, oh, go ahead, Lee.
I've just tried to listen and get a better understanding of the issue, and it's more commentary than it is question, but they're questions I think that need to be answered in the longer term. And let me just start out by saying that I'm trying to look at this more broadly from the county perspective as to what the implications are beyond the city of Ithaca and the adjoining areas. And I applaud all of you for working on this situation. And I do have a pretty good familiarity with this, having worked in emergency services at the county level for 30 plus years. I understand the conditions down there and some of what the challenges are, and I'm glad to see it being addressed. But to Dan's point, what is the ask? And what I'm hearing here today is that beyond the memo that come out, it's beyond just the dollars that are mentioned in here, which are pretty significant. And it's also beyond the services that have been cited. I heard early on the mention that there needs to be a county policy in conjunction with the cities, and that the city's policy adoption is contingent on a county commitment. And it's understandable, but whatever policy the county develops certainly has implications that go beyond the city. And I can almost see where we're stepping into the area of land use, home rule, tacit endorsement of encampments, wherever they may be. Does that mean we're looking at 16 policies with every town and village? We know the situation isn't necessarily extending beyond here, but it sets a precedent for us. The other part to this is, for me, I come back to Cynthia. What's problematic when I read this the other night, and again, it's just in general, it refers to the county having a de facto policy. And I don't know that the county has ever been in a position where it was expected to have a policy. And, that's kind of a change in what our role is. So I just would caution the rest of my colleagues to look very carefully at what we do, because what we do here is something that by implication needs to extend out and potentially affect all our other municipalities. And I'm not sure how they would react to this.
Okay, thank you, Lee. Amanda.
Yeah, I just wanted to note that Kit Kephart wrote in the chat that social services currently visits the encampment weekly to provide regular outreach to people. So I think, in case somebody didn't know that, that's what she added. And I would just add that I'm not on the HHS committee, but I would not be prepared at this time to move forward with any sort of county commitment until more discussion has been had. Thanks.
Okay, last call. Anybody that has not spoken that would like to speak? Cynthia.
I guess I'm looking for some kind of straw vote of indication. Should our group just stop or should we keep talking?
Right, thank you. That is our last piece of this conversation. So the question is, I don't exactly know how to frame it. Maybe that was just the best way you framed it. Should you keep going? I wrote down a phrase earlier, keep exploring. That's what, so I'm going to start. And I think you should keep exploring. I am supportive of this idea with caution. There's some unanswered questions, but I actually like some of the answers that I got today. They make it a little easier in terms of what's expected from the county, at least. And that was that not everyone felt this way, but mostly you're not looking for a large change in how we deliver services, maybe a little more focus on outreach, but not drastically different. And you're not, for instance, and you're not expecting DSS to pay for housing. That's makes it easier on our end. So I'm going to say that I do like this approach. Keep exploring. I would like to hear more details. Who would like to speak next?
What details do you want?
The money.
Well, we're asking the county for a lot of money.
I haven't heard that yet. I've heard the total price tag, but I haven't heard how it gets broken down. I assumed those dollar figures were the total cost, not the county ask. Am I correct? $1.5 million to build, $1 million to run it every year. So based on that, I would like to know, how much is the county paying? How much is the city paying? How much do you expect to grant?
Correct me if I'm wrong. The city's making a commitment to build it and prepare the land and some other things. But we're asking the county to pay for ongoing years for this to be managed.
Is that everyone's understanding on this committee?
Well, I would say the city has not made any commitment yet.
Yeah.
We're asking the city for a commitment to assist in developing the land. We would be asking the county for assistance in providing funding for management of the facility. I think we would also need to look to third parties because obviously a big chunk of this population is currently ineligible for county funding, which is why they're there. So we would need third-party donations in order to fund the program every year also. But we are looking for that partnership in the city and the county to commit to those financial commitments.
Okay, I guess I need to ask again for clarity then. $1.5 million roughly to build, $1 million to run it every year. Are you hoping that would be the county's bill, or I assumed that was going to be split?
This is all in. We're just coming together with a draft budget. Again, we're just.
And we're also, as Carmen said, we're going to be asking for a lot of volunteer labor, private donations. So I think that was a high number, and we're hoping to come in lower.
But it would be expected that each of those entities that we just named, the county, the city, and private partnership, private business or whatever, would be splitting that bill in some way.
Yes.
Sounds accurate to me.
I mean, fundamentally, we need to know, which we don't have that information yet, who would be living there. What is the population of individuals out there who would choose to live there, who aren't even eligible for DSS funding? So then we would need to figure out how much that funding we would need to find from third parties. But if there were opportunities that we could get funding to support the individuals who are eligible but not yet ready, either for lack of housing or not yet emotionally ready for housing, would there be support to help cover the costs of housing those individuals by the county?
Shauna, Randy?
Yeah, I guess what I was wondering, is there any way that maybe Kit and administration could get an idea of the numbers? Because Kit's the one that heads up DSS, and she's the one who you know, quite honestly, would be more informed than all of this at this table. And I, you know, from what I'm thinking and the services that many of our people that live down there, I honestly don't think $1 million is anywhere close to where we'd be. But I would love to hear from Kit and administration, because I think all of us need to know where we're going and how much it's going to cost before we have further conversation here or commitment.
Does Kit or administration wish to say something at this time?
Sure. So I can speak. I'm not sure. So sorry. I'm not sure if you're looking for a projected cost that I would anticipate. I don't have a way to do that because I think I don't fully understand all of the details. I think that what I would say is that I certainly have real concerns about how I think it's an amazing process that people are thinking about this, and this is, you know, this group of folks that live in the encampment is a huge concern to all of us at DSS. We have an outreach worker that goes weekly to the encampment that visits people. Our goal is always to try to engage people, to help them, you know, to help them engage with services. I think that there are some real barriers to that, and I am very concerned because while I want to support them, I think one of the challenges is that we at DSS really can't do that without people qualifying for state services. So that creates a bit of a struggle for us. And you know, the other issue that's been noted here today, I think, is the real limitation. Although we have more and more housing coming online, which is really encouraging, there are real limitations. There are real concerns about availability of housing, especially when we look at a population of people that may or may not engage with services that are available to pay for housing. So that becomes kind of a question for me in terms of how do we serve people? How do we begin to support people? So I'm sorry, Shauna, is there another piece that you would like to hear from me specifically?
No, I mean, I guess I was just confused as far as I know that county cannot give funding to people directly. And I think that includes services as well. So we could not provide healthcare, that type of thing, care management for those that are ineligible for DSS services. So I don't know if there's a workaround or something to that effect, but we would definitely need legal to weigh in a bit.
Jerry, I see your hand up, but I need to wrap this up. So I'm going to just hear from legislators at this point. And Randy.
My straw vote is yes, please move forward. And I agree with everybody that we need to understand more of the big picture. And I think a collaborative of the city, the county, private people is the only way it can be fixed. And it's a problem that's been ignored for too long. And there's many others, but I think there's a strategy that needs to happen. And I think this is the first part of that strategy. So.
Thank you. Any other legislators want to weigh in? Veronica.
Yeah, my straw vote is also yes, move forward. I mean, I think it sounds like the people balking, the hesitation at moving yes is that we need more details, but what y'all are asking for is the go ahead to get more details. So it sounds pretty good. And just ask that, I think y'all take into account like I guess continue to be transparent with the planning. Remember what folks have said, this is like pretty urgent, needs to move ideally fast, needs to be fluid, needs to be legal, and needs to bring in some of these other stakeholders that we've mentioned.
Thank you. Any other legislators? Okay. I hope you're able to distill something from what you heard today. I'm not sure exactly what it is. I think maybe you do. Any last words? Going once, going twice?
Did everybody vote?
Everyone spoke who wanted to, apparently. Is there anyone? Yeah. There's 5 on this committee and there's 14 altogether.
How many on the screen?
God, Rich. Okay, Ann Corman has her hand up. Here's another legislator who wants to weigh in. Go, Ann.
Thanks. I concur with what other legislators have said. You know, bring in more people to sit at the table and you know, coordinate as with however much our administration at the county suggests with DSS and also our administration. And yes, my straw vote is to yes, go forward. Thank you for doing all this.
Thank you, Ann. Okay, I'm going to move us out into the next thing. Thank you so much for all this. There's a lot there, and stay in touch. Let's keep talking. Okay. Yeah. So I want to apologize again to everyone for my scheduling of this. This is not my typical way of doing it, and I just didn't know what else to do today. This needed to be hashed out in detail. So specifically to Liddy Barger, Simone Gaston, Melissa Perry, I owe you all some ice cream. That's how I'm going to make it up to you. And next up is Liddy Barger and Simone Gaston, Tompkins County Homeless Needs Assessment Report. You're on.
All right, great, thank you. And hopefully everyone can see my screen. My name is Simone Gatson. I work at the Human Services Coalition, and I'm staff for our continuum of care. I am also the lead for our coordinated entry process, and I'm here with Liddy Barger, who's the Director of Housing Initiatives at the Human Services Coalition. She's also the coordinator for our continuum of care. So the county, as well as the City of Ithaca and our continuum of care, commissioned a report from Lisa Horn from Horn Research to conduct a needs assessment to look at homelessness and housing, across the county, to kind of look at the gaps and barriers in service and how we could best meet those needs. So we've kind of brought together a presentation of those findings and those recommendations. Obviously, the report is very lengthy and there's a lot that we couldn't include in a 20-minute presentation, but these are the findings and recommendations that our governance committee of the continuum of care found to be most relevant for our conversation with you all today. So, okay. All right, great. So our agenda for today, first, we're going to start off with some definitions and methodology, so we're all on the same page about what we're talking about. We're going to go through some of the data findings. Liddy is going to chime in with some of the recommendations, then we'll open it up for questions. I just want to start off with the mission of our continuum of care, so why we're giving you this presentation today. The Ithaca Tompkins Continuum of Care, or New York 510, is a local community planning network of public, private, and nonprofit partners. So everyone from street outreach to housing providers to city planners, really everyone who has some kind of stake or interest in homelessness across the county, we are inviting into the table to talk about it. The whole mission of the continuum of care is to make homelessness rare, brief, and one time in Tompkins County. And so just kind of talking about some of the work that we do, like I mentioned, organizing that community-wide effort to prevent and end homelessness based on that definition of it being brief, rare, and one time. Through this, we have committees, we have regular meetings, we also organize our homeless management information system, or HMIS, which we'll talk a little bit more about in a second, which is kind of a live picture of what is happening with homelessness in our county. So yeah, we also provide funding and support to nonprofit agencies. So we are the collaborative applicant. The Human Services Coalition is the collaborative applicant to HUD. So we help to secure all of the funding for our permanent supportive housing projects and other projects that help to support our homeless population in Tompkins County. And then we also promote access to supportive services and housing through the coordinated entry process, which kind of allows homeless individuals to do one intake to be connected to all of the resources in our continuum of care. So again, a few definitions, just so we're on the same page. How do we define homelessness? So in our continuum of care, we have to follow HUD's definition of literal homelessness. So this is when someone is sleeping in a place not meant for human habitation, so outside in the encampments, in a car, or in our emergency shelter through DSS. Individuals who are fleeing domestic violence are also considered homeless. So this doesn't include people who are couch surfing, who are what we would call at risk of homelessness. And we can get into that a little bit later as well. How do we define chronic homelessness? This is going to come out when we talk more about the data findings in this report. But chronic homelessness is an individual who both has a disabling condition and has been continually homeless for at least 12 months, or has had 4 occasions of homelessness totaling 12 months. So kind of a complicated definition there, but just something to keep in your mind when we're talking about the difference between first-time homelessness and chronic homelessness. How do we define permanent housing? So permanent housing is private or supportive housing where tenants can live indefinitely, so there's no end date to it. And then supportive housing is affordable housing where tenants also have access to support services in addition to housing. So we're combining and mixing and mashing, definitions, thinking about permanent supportive housing or somewhere where you're living indefinitely and have access to support services. So just to shed some light on some of the terms we've been throwing around for the past hour or so. Great, so methodology for the report. Obviously it was sent out, but I just wanted to dive into this so that we have a clear understanding. So one of the first things that Lisa did was do a deep data dive. So she looked at our point in time count, which is a snapshot, a single night where we count all of the sheltered homeless as well as the unsheltered homeless individuals in Tompkins County. She looked at our housing inventory count, which is basically a list of what housing is available and what housing do we have available that's currently being used by people. She looked at our annual performance report as well as our system performance measures. So that's really, how well is our system performing at exiting people to permanent destinations? Where are people being exited to? And things like that to kind of give us a sense of how the whole system is working. And then finally, our homeless management information system, which, like I said, is a real-time tracking of who is homeless and who needs services, referrals, things like that in Tompkins County. She also looked at some other assessments over the past 10 years or so that have been done. And yeah, she also did qualitative interviews with stakeholders as well as people with lived experience and compared all of that data to 9 COCs. So those immediately surrounding Tompkins County, as you might be able to see on the map right there. And then some of those with similar population sizes and similar geographic makeup. So what did she find? She found, first, if we're looking at some of our measures of how we measure how well our system is performing, length of stay. So length of stay is what it sounds like, how long people are staying on average in our emergency shelter, and that has increased. So for the funding year 2020, the average length of stay for all households in our emergency shelter was 91 days. So it's about 3 months on average that people are spending in our emergency shelter. Measure 2 are returns to homelessness. So this is, after people are being exited to permanent destinations, are they returning to homelessness? And our returns to homelessness in Tompkins County are actually the highest of our comparable COCs. So 32% of individuals who exited to permanent destinations returned to homelessness within 24 months. And then finally, measure 3. So first-time homelessness and chronic homelessness. So what we're seeing is fewer first-time homeless and more chronically homeless individuals. So we're seeing about half, or 45.1% of our homeless population in 2020 were chronically homeless individuals. And now I'm just going to kind of break down those data points so that you can have a better understanding as to why we're seeing these things. So in terms of length of stay, right? When we look at a snapshot of 2021, we had 22 beds available for people on our continuum of care and 122 people who were currently experiencing homelessness. So essentially what we're seeing here is a bottleneck effect across our supportive housing programs and also low-cost housing in Tompkins County generally. Once people enter emergency shelter, they can do all the applications, they can do all the right things, but there isn't necessarily a bed for people to be in or to go to. So we're seeing low vacancy rates across all levels of affordable housing and also high rent costs, which are a fundamental barrier in moving people. So, in talking with providers across our COC, even with increased access to subsidies, especially over this past year, some people who have subsidies, who have the financial means to get into housing just cannot find a bed to move into, or a unit with rent that will fit under the rent cap for that subsidy. So just things to be thinking about in terms of the bottleneck effect that's leading to longer length of stays in our emergency shelter. Finally, this is just a graph that talks about returns to homelessness. So as you can see, we are the highest in returns to homelessness with our comparable COCs, about 32%. And then types of homelessness. So we are seeing a reduction in first-time homelessness and an increase in our chronically homeless population to being about half of our total homeless population. So what's causing these trends? I've already touched a little bit on this, but just to make it very clear, our low-cost housing stock is critically low. So we do not have beds to move people into, even when they do have the financial means to move there. Individuals experiencing homelessness are having trouble with accessing and maintaining housing and services. So when we're thinking about returns to homelessness and thinking about chronic homelessness, what we're really seeing is that, we can move people into permanent destinations, but they do need the support to maintain that housing once they get into it. And finally, the projects funded through our COC are constrained in their capacity to adequately serve our homeless population. And you can see that very clearly in the snapshot, where we have 22 beds and 122 people we are trying to serve with housing. So some other data observations I just wanted to touch on a little bit. There were some considerations for couch surfers. Couch surfers do represent a sizable population at high risk for homelessness in Tompkins County. They're not currently served or counted by our COC, despite the likelihood that they will experience continued homelessness. Because they don't fit very clearly into one of those HUD categories of homelessness, we can't currently serve them with a lot of the projects that we receive HUD funding for, and there isn't a lot of targeted outreach serving that population right now. There's also different diversion efforts in our COC that require individuals to double up if they have the ability to do so before they enter emergency shelter. But again, there's no targeted outreach efforts to prevent them from entering shelter if they are currently couch surfing. Next is some racial disparities. So Black and African American and Hispanic Latino households are disproportionately represented in our homeless population. And we also found that Black and African American adults in particular are more likely to return to homelessness than households led by white adults. We saw that trend particularly in our transitional housing, that a lot of Black and African American households were returning to homelessness after a stay in transitional housing. So that is something that we're going to look some more into, but Lydia will touch on that in a little bit. And then considerations for youth. So a lot of the youth that were interviewed for this report indicated they have just generally a lack of knowledge about the resources that are available to them and are also resistant to utilizing the emergency shelter. So they are more likely to be represented in our couch surfing population and underserved for all of the reasons I previously stated. So, and that's it. So Lydia, did you want to touch a little bit on the recommendations?
I will. Thank you, Simone. I'm going to try to do this really fast. So forgive me. We have good slides. We'll send them out. You guys can read all of this, but I do want to be respectful of everybody's time. So bear with. These are our recommendations. They are ranked, and they were ranked by our COC governance committee, who read and really took a lot of time to consider the many findings of the report in full. But these are our top 5 here for that comes from the Continuum of Care Governance Committee. Next slide, please. Our number 1 recommendation is to increase the number of permanent supportive housing units in our continuum. Permanent supportive housing is an intervention, a solution that really is disrupting the cycle of homelessness. It quickly, when there are enough units available, can use housing first, and the systems that we have in place, like coordinated entry, to quickly move somebody out of homelessness into a permanent bed. Permanent supportive housing is not time limited in that people can live there as long as they need and want to, and does come with sort of person-centered wraparound services, all of which contribute to people's success, as demonstrated by the lower rates of return to homelessness after exiting permanent supportive housing. Simone kind of called this out a second ago. We're finding that, especially for Black and African American households, the data is showing us that permanent supportive housing is the housing type that results in the least reoccurrences of homelessness for that population. Next slide, please. So, oh, that slide is like half empty. Weird. So there
Give it a
is
death
data.
toll.
There is data in that slide in the packet. We'll send this out if you didn't get the slides. We also recommend increasing the number of what we call low-cost housing in the continuum in general. You'll notice that we actually very carefully have chosen the word low cost and not affordable, only because of the AMI and the factors that go into what is called affordable housing. I would say most, if not all, of the affordable housing that is available in our current continuum is unaffordable to our population of people experiencing homelessness. So when we're talking about low-cost housing, we mean housing that's affordable to people at 0 to 30% AMI. And we did say especially single room occupancies. And if you could see that little chart, it would make sense why. So I'm going to skip for now. But basically, we have a whole lot of single individuals in our system and not a lot of small units for them to move into. Our families and larger sized folks are faring better in permanent housing, market rate or affordable permanent housing than our single individuals. Next slide. We also would recommend the creation and implementation of a enhanced housing navigation type service. This would be somebody who's really housing focused in their case management supports, but is also flexible and able to serve folks throughout their journey in the homeless response system in a more cohesive factor than we currently have right now in our system. There are some people who can help with some parts of housing for folks who are in this, who are looking for housing or experiencing homelessness, but there is no really one place that is able to do all pieces required for a person to successfully sort of transition from, let's say, an encampment space into a permanent housing location. And so in the next slide, you'll see a quote from one of our stakeholders that I think actually sums this piece up really well. People are feeling like our system is fragmented or decentralized, that there's a lot of running around, there's a lot of hoop jumping and filling out what feels like filling out the same with a lot of applications, but over and over. Adding that enhanced housing navigation to our continuum, I think would help ease the burden for both the people who are doing the work right now and the people who are receiving the services, in that people could follow somebody through their entire process. Next slide. Oh, where's my data? Let's see. So this recommendation involves heightening outreach specifically to some of the populations that we touched on earlier, which include youth experiencing homelessness, people of color, and our couch surfers. There are many reasons we would like to heighten this outreach. The one that I'm going to rise up today is that, as Simone sort of mentioned, we would consider this a prevention effort. So those folks that are couch surfing or doubled up right now are sort of precariously close to entering our homeless response system. And we believe that some targeted investments in that prevention could ease the burden on our homeless response system and make it so a person in theory doesn't ever actually have to enter shelter to be served with homeless response resources. Next slide. Oh, great, this one has data. Our fifth and final recommendation is to expand the capacity of our emergency shelter. So we do have less beds per capita than our neighbors. If you go to the next slide, actually, so we have 20 year-round beds at St. John's, and there's 9 in our domestic violence emergency shelter. One of the appeals of expanding the capacity of our emergency shelter is that something that we're hearing regularly, and it's reflected in the report, is that folks who are sheltered at the motel sites are feeling disconnected from their services. They're sort of, there's not staff, there's not shelter staff on site full time that they can access when and where they need them. And they are further away from other services that they need to access. So this recommendation has to do with expanding the number of on-site beds available to folks in shelter, and also expanding the capacity of services that the shelter is performing for those folks in terms of case management and housing search and those things. I did that in record time. Thank you. We will send out slides. I will say also that just as far as next steps for the continuum of care, we are using this report as the foundation for a lot of our work in the coming year, and have some really targeted time-limited committees this year that are all working towards observations or goals that were included as part of this report, including racial equity committee, what we're calling a sustainability committee, which really has to do with like, how do we help people stay housed once they find housing, and some other very pertinent committees. And then we're also working to basically create a matrix that takes the recommendation and the various funding sources that exist in the world right now and puts them together in such a way that people who are like, I'm very interested in recommendation number 3, creating an enhanced housing case management program, could figure out how to get that funded, use the data from this report to support future funding applications. We want people to share this information widely and be able to incorporate it into your own agencies and other operations to get the best benefit from this awesome, dense report that we have in our hands. That's it. That's our report. We are happy to answer any questions. And thank you for your time.
Thank you. Do we have some questions? I've got one. We heard it today. I've heard it other times. When we talk about people in the encampments, some people say they don't really want to be in a place with rules, structures, whatever. We hear that kind of comment. And I personally don't know how to think about that. I'm wondering if you have some thoughts of your own or any research or anything you want to say about that.
Sure. I mean, I have thoughts. I guess people don't want to be forced or compelled to do very much ever. The continuum of care would never recommend sort of like using housing as a stick in any way. But we are, there's a range of people experiencing homelessness and a range of willingness to accept services and programs. And there's also a range of services. I sort of feel like that is true. There are people who do not want to accept services of any sort, but also perhaps the services that we're offering are not quite the right services yet. And it's not so much about like a refusal to accept services, but it's a refusal to accept the wrong services or services that don't feel right to the end user. I don't know if that really answered that at all.
That does
that would be my answer.
Thank you.
Yeah.
Any other questions? Randy?
Yes, thank you. I liked reading the report. I liked all the data. It was very helpful for educating me on the subject. It probably created more questions than answered. I probably know less now than I did before, but
I feel like that every day.
Yeah, one observation I saw in the report was how little housing has even been built for families, low-income families, or any other family. And so that was one comment. And it has as we look at the solution for the homeless, one of the things they talk about is no-cost housing. I think maybe Travis brought that up. Has there any no-cost housing other than I noticed on one of the data that there are some temporary housing solutions that are out there, OAR and other places. But has anything been built? What's all the building going on? Has any low-cost housing been built?
I mean, there's been affordable housing. This is why I sort of called out the difference between like affordable and low cost housing. Our affordable housing pipeline is growing. Art House came online. We have the Green Street project coming. There's some projects in the pipeline. I am not aware of any no cost housing at all. I mean, even in the permanent supportive housing programs, obviously there's a cost, but tenants themselves are paying a portion of their earnings, or if they receive benefits, some of their benefits are going towards their housing. In our community, I don't think there's any such thing as no cost housing. Even the transitional units, there's some cost to the tenant if they have some income.
Thank you.
But yeah.
So what I said was we don't have no income housing.
Oh yeah. Yeah. That's also true. That's true.
Right. There's a big difference. I think if you're a single person, would you get $280 a month from DSS toward housing? And where do you live? You can't rent a room for $280 a month. Even at some of the buildings that we would never want to stick people in, you can't get a room for $280 a month. So there's a huge difference between low income, affordable, and no income. It's night and day between all three of them.
Yeah. I mean, the big takeaway is like, we need more of everything yesterday, right? Like, we need to broaden and deepen all of the housing options. What was a crisis is like, even it's worse. It's worse than a crisis, I would say, in terms of supply.
Okay, any other last questions or comments? Veronica.
Thank you. I have a million tiny questions that I might email you about later. But the one right now, there's a line in the report that says, talking about people living in the encampments, that said, for the most part, interviewed participants believed a sanctioned encampment would not be an effective solution. And we just spent an hour talking about the possibility of one. Can you comment?
I mean, good catch, good eye. That is a thing that was said by some of the 18 people in the encampment who were interviewed. At this time, the continuum of care is curious to learn more about tides, but has not sort of. That is what we heard from people in the encampment at the time of this report. Yes. And I think it had to do, I don't want to speak too much about the details of why that was coming up, because I don't want to get it wrong, but I think it really had to do with enforcement and concern about how something like a sanctioned encampment, what enforcement would look like of non-sanctioned encampments.
We have 999,000 other questions.
Not for right now.
You can send us an email. We love 100 small questions or one big one, either way.
Thank you.
Any other questions, comments? Randy.
A lot of information in your report. And I'm much like Veronica, I have a lot of questions. It'd be nice to meet and just talk about homelessness, with a group. So if you get together and discuss this report with other people, I'd be glad to come. So.
Sure. You are always welcome at our Continuum of Care membership meetings or Homeless and Housing Task Force too. So the Continuum of Care is like, we're quietly chugging along, doing a lot of this work. It's public, it's open. People are welcome to plug in. This planning work has been going on for, a long time, many, many years. So I'll be more diligent about sending out the messaging around how to plug into Continuum of Care, homeless response planning, ongoing meetings that we have. There's a lot of opportunities to talk about homelessness.
Simone, Liddy, thank you so much. Apologize again for the delay. Your ice cream certificates will be in the mail soon. Okay. Seeing how this was going today, and I just want to say again, I'm taking responsibility for it, but seeing how it was going today, I went over and talked to Melissa Perry, and we just decided it wasn't going to happen this time. It was just too much in one meeting. So we're going to reschedule the child care system in Tompkins County meeting for another time. Let's take care of our resolutions, and we're gonna, it is my goal to stop at 5 o'clock. I think we can do it. So let's see, we have resolution authorization to accept funds, execute contract, create positions, and budget adjustment, perinatal and infant community health collaborative grant. Is there somebody that would move that? Randy, is there a second? Veronica, thank you. Discussion. Frank, anything that needs to get said as an introduction to this?
Just that our Community Health Services Division applied for a grant for $250,000 a year for 5 years to expand our community health worker program to help us reach underserved populations in our community for our maternal and child health programs.
Okay, thanks. Any other discussion? Ready to vote? Randy? Yes. Veronica?
Yes.
Travis?
Yes.
I'm a yes. I think Mike is just not here. Okay. So that's unanimous. Thank you. And then the next resolution, reappropriation of funding received in 2021 to the 2022 budget from the Park Foundation. Somebody move that. Veronica moves. Travis seconds. Frank, anything to say on this one?
Just moving funds from a COVID grant from the Park Foundation, which we very much thank them for, from 2021 to 2022.
Thank you. Any other discussion? Okay, let's have a vote. Travis?
Yes.
Veronica?
Yes.
Randy?
Yes.
And I'm a yes. That's unanimous. And then we had the item that was added to the agenda, which was the Genoa, I don't know how you pronounce it. Health approval of selection of Genoa Healthcare LLC for co-located pharmacy services. So is there somebody that would like to move that approval of selection? Randy moved, Veronica seconds. Thank you. Discussion. Frank, do you want to say anything?
Sure. This is the first time I've ever done this process too, where you guys are just voting and it doesn't go to the full legislature. So my apologies for the delay in getting it to the packet. But you'll note that we, several months back, that we were going through an RFP process to find a in-house pharmacy vendor for the mental health building. Essentially, they'll be leasing space on the first floor. We went through that process. The review team selected Genoa Healthcare. They have a long track record of doing this type of work, and we're excited to be able to co-locate with them in the building. And we just need your approval for us to finalize their selection and begin contracting and getting a lease signed.
Thank you. Questions or comments? Veronica.
Just commenting as a sometimes patient, it's just so much nicer to have a pharmacy right in the building where people prescribe you stuff. So this seems great.
Anything else? Okay, let's have a vote. Veronica.
Yes.
Randy.
Yes.
Travis.
Yes.
And I'm a yes. That's unanimous. Okay. Let's see. We had another resolution, but I think no one's probably going to move that one. So let's get the minutes approval. Is there somebody that would move the minutes for April 18th? Veronica moves, Randy seconds. Any discussion? Okay, let's have a vote. Travis?
Yes.
Randy?
Yes.
Veronica?
Yes.
And I'm a yes. Okay, so I think that was all the business, right? We have 6 minutes, and I'm just going to throw one more apology out there to all the department heads for not having sufficient time for everyone to give a full report. With that said, who would like to say anything? We have 6 minutes left, so let's use those 6 minutes. Are there any departments that would like to make announcements, report on anything? Going once, going twice. Ken Clark appears on the screen. Go for it.
On Friday, excuse me, at noon, OHR is going to be hosting with the Ithaca Asian American Association a program called on debunking the model minority myth. This was originally a program that was a faculty and staff program for Cornell, but they've opened it up to the community. And this will happen from 12 to 1. If anyone is interested in attending, let me know, and I will send you the link for registration.
Can you say the title of that program again?
Okay, it's debunking the model minority myth. I'm sorry.
Okay.
Yeah.
Thank you.
Which has to do with the ways in which persons of Asian descent have been perceived in this way, which really does not capture the fullness of the experience.
Thank you.
Mm-hmm.
Okay, anything else from any department heads, from any legislators, from any staff? Don't be shy. We do have 4.5 minutes. Okay.
Just as an announcement, it's not my announcement. This Saturday, May 21st from 11 a.m. to 2 p.m., there will be another community mental health awareness fair hosted by Family and Children's Services. I know our mental health department is going to be there, as well as a bunch of other organizations such as REACH, the Advocacy Center, a bunch of others that have come up today. That's 11 a.m. to 2 p.m. in Press Bay Alley in the Family and Children's Services parking lot. I went to the one that happened like a week and a half ago at Bernie Milton Pavilion, and it was fantastic. And I'd recommend going if you can and spread the word.
Thank you. Anybody else? This is your chance. Microphones are hot. Okay, well, as I mentioned at the beginning, the next meeting has been rescheduled due to the Juneteenth holiday. It is Wednesday, June 15th at 1 o'clock. Any last business before this committee? All right, we're adjourned. Thank you, everybody. I don't feel as good as I usually do. Well, I had to cancel.
Well, yeah. You can make a plan for when she'll come back.